Hey, thanks, Alan, and thanks everyone for joining us. This can be kind of a scary time for all of us. The news has really been preoccupied with this new coronavirus, which has been named COVID-19 by the World Health Organization as recently as 2 days ago, and it's a lot of information out there and a lot of disinformation. So we want to take this opportunity to bring some clarity, put some things into perspective, and hopefully help everyone here make smarter, safer decisions for themselves and for their loved ones. To start off with, what is a coronavirus? A coronavirus is actually an entire family of viruses that are very, very common throughout the world. They infect animals, they infect people. The most common ones in the news over the last decade or so have been the severe acute respiratory syndrome, SARS, and MERS, the Middle East respiratory syndrome, which made headlines over the last 15 years. What has not made headlines is that almost everyone has had a coronavirus at some point. The vast majority of the coughs and colds that people get anywhere in the world are caused by a coronavirus. It tends to be a different coronavirus than the three that we've become most familiar with, being SARS, COVID, and MERS. But anytime you or your children or a loved one has a cough or a cold, there's a very high chance that it is one of the viruses in this overall family. The other thing to point out is also that the spectrum of disease that these viruses cause is widely variable. The vast majority of people who catch a coronavirus catch a very mild illness, a fever, a cold, something to that degree. We are only familiar with COVID, SARS, and MERS because they are extraordinary in that they cause, or they can cause, a severe illness. And it is, as we'll go over today, it's very, very rare for even this coronavirus to cause a severe illness. But it has been known to happen, which is why we're going to discuss this today. The question of how this virus spreads, I think, is important to a lot of people. This virus originally made a transition from some type of animal, and we're still trying to figure out exactly which one it is, into people, and it seems to have happened in a seafood market in China. Since that initial jump happened, the virus has started spreading person to person, and that person-to-person transmission has been seen extensively throughout China as well as in other countries around the world. So this is something that you could catch from another person. This is not something you're likely to catch from an inanimate object. You're not going to catch this from a toilet seat. You're not going to catch this from your dogs or your cats, your pets. This is something which will be transmitted from one person to another. The other big question is, how contagious is this? Because we've heard a lot about this being contagious. This virus is roughly as contagious as influenza, which is to say that it is spread in a very similar way. It's person to person, and it's through droplets, which I'm being told my volume may not be loud enough, so let me try to help you out. Thank you very much. It's roughly as contagious as influenza, and it is transmitted in a very similar fashion. And it is transmitted roughly to people who are in relatively close proximity to someone who is infected. And we're going to go over that a little bit more here in a second. How far has the virus spread has become something that has gathered a lot of attention in the news as well. Currently, the coronavirus exists in 28 countries around the world, but it's important to note that the vast majority of these cases occur in mainland China, over 99% of them. To date, there are roughly 64,000 cases of coronavirus in the world, and over 63,000 of them have been in mainland China. Less than 500 have occurred out in the rest of the other 28 countries of the world. We are relatively early into the lifespan of this virus. It was only identified in December and has started making news since January, so we're talking about less than 2 months. There's a lot of unknowns, and there's a lot of information that is trying to get disseminated to the public very quickly to keep everyone abreast. At this point, I would like to point out that in any situation like this, which is rapidly evolving and where there's a lot of information, it's important to be able to distinguish quality information from noise and panic. And there's a lot of noise and panic surrounding this virus. I would ask all of you that when you're consuming information on this and when you're passing that information on, please make sure it comes from a validated and verified source. All the information I'll be sharing today comes from the World Health Organization, the Centers for Disease Control, and from the New England Journal of Medicine, which have been verified experts in this area, and we are trying to make sure everyone gets accurate information and dispel a lot of the myths and rumors which have been circulating around this virus and what you could do to keep yourself healthy over the last few weeks. So the spread of COVID-19 tends to occur when a person who is infected with the virus coughs or touches a surface which is covered in sort of the saliva or mucus from their lungs and their mouth. The way that a person becomes infected is when the virus particles either come into contact with your nose, your mouth, or your eyes. It is important to note that when a person coughs, they tend to create a cloud of virus particles which go into the air. They tend to fall down very quickly, and once the virus comes into contact with a surface, it's only able to survive on that surface for a few hours. It does not linger there very long. So the majority of infections occur when an uninfected person comes into contact with an infected person, and those virus particles come into contact with your mouth, your nose, or your eyes. As I mentioned before, this virus is roughly as infectious as the flu, and it infects people who are close to a person who is currently infected. That area of spread is roughly 1 to 2 meters, so 3 to 6 feet. If you are within about 3 to 6 feet of someone who is actively infected, coughing, sneezing, throwing that cloud of infectious material into the air, that is when you are at highest risk. If beyond that spread, beyond that distance, your risk drops substantially. Symptoms of COVID-19, so the ones which are most prominent and have been found in almost everyone who has this virus include fevers, coughing, and then shortness of breath or difficulty breathing. We are not seeing a lot of runny noses. We're not seeing a lot of sneezing. There have been some reports that sore throats, diarrhea can be a part of this syndrome of infection. A couple things I would like to point out at this point. The vast majority of people who have become infected with COVID-19 have had a relatively mild illness. Out of the 64,000 people who have caught this, less than 1,500 have died, and all but one of those people have been in mainland China. The 500 plus people who have become infected with this virus outside of mainland China have survived, with the exception of one person in the Philippines. It's also important to note that the vast majority of people are not becoming very ill with this. They're catching milder symptoms and not requiring long-term hospitalization or being at risk for death. That being said, there is a very small portion of people who do become very sick, and those people tend to be people who are elderly, very young, meaning less than a year of age, or those who have other significant medical conditions which are ongoing. What should we do? What should someone do if they believe they have been exposed to COVID-19? And this is for anyone who is in an area where there have been cases and you think you may have come into contact with it and you're starting to display symptoms. First and foremost, do your best to avoid public places, including public transportation. The goal here being to try to limit the number of people you are exposed to if you are in fact infected. Second, we are recommending self-quarantine, so stay at home. The greatest risk is for people who are within 3 to 6 feet of someone who is infected, so it's best if you are ill, whether it's with this or with something else, to try to stay away from other people, including family members, anyone who is very young or very old, and stay home. If you believe that you are actually exposed to COVID-19, we are recommending you contact your national health authorities. Every state in the United States and most countries have a means by which you can report, I think I've been exposed to this and I'm starting to have symptoms. And the protocol in each of these countries is slightly different. In the United States, the state health authorities all have phone numbers that can be reached to say, I think I might be exposed, and they will talk you through what your risk is and what your next step should be. If your symptoms are severe, please go to an emergency room. If they are not severe, we are recommending you try to avoid the emergency departments. This is cold and flu season in the United States. And the concern here is if you are infected, you may expose other people to it. If you are not infected, you will likely expose yourself to the other illnesses which are at play in the current environment, and you may make yourself worse. If you are in China and experiencing severe symptoms or a fever, the government has set up designated fever clinics where you can go and be evaluated and tested as needed for this. In many cases, if you have a significant travel history or exposure, quarantine of some type may be required either in a healthcare facility or at home.
Ahmed, is this a good time to add people should still be considering getting flu shots for the basic flu during this time, or is it perceived as too late?
You know, I think it's a great question, a great point to bring up right now is, yes, this is cold and flu season through all of North America and Europe, basically the Northern Hemisphere. One of the things that you would recognize is that the symptoms that I discussed as being prominent and harbingers of COVID are identical to symptoms of the flu: fevers, cough, shortness of breath, feeling unwell. There is a vaccine for the flu. The flu is far more prevalent than COVID is right now, and in the event that this becomes widespread in the U.S., at least being vaccinated against the flu will help us differentiate those people who have COVID versus those who have the flu, and you may be able to protect yourself from catching both by reducing your exposure to the healthcare system and people who may be potentially ill if you've been vaccinated. So if you have not been vaccinated, please make an effort to go out and get vaccinated as soon as possible. There was a question about masks, and should we be using masks? How effective are they? What exactly are they good for? First and foremost, masks are only effective when they're used in combination with good hand washing and hand hygiene. So either washing your hands with soap and water for 20 seconds or using an alcohol-based alcohol rub to clean your hands. As I mentioned before, the masks are actually intended for the people who are sick rather than the people who are well. There's been no evidence to suggest that wearing a mask if you are well is actually effective in keeping you from getting sick. The benefit comes from someone who is ill. If they wear a mask, several things happen. One, if and when they cough, that cloud of particles tends to be diminished because the mask tends to catch more of it. Second, the mask tends to keep people from touching their nose, their mouth, the two areas which are at highest risk for transmitting this disease. If you are wearing a mask and you're coughing, once the mask gets wet, it's important that you dispose of that mask in a closed trash container and replace the mask. Putting it in an open trash container can create some risk for aerosolizing the particles, which could make other people sick in that area. And having a wet mask really limits its ability to be effective. In certain areas, particularly in China and other places, there is a larger push to wear these masks in an effort to decrease the amount of virus particles in the air, but it is not proven in a place that's not currently having it being endemic that it's effective or helpful to wear them. As far as treatment for COVID-19, currently there is no vaccine for this. There are several that are in development, but it will likely be at least 1 to 2 years before they're commercially available. There is no specific treatment for this. Over the last few weeks, we've seen some reports of experimental drugs being used, which have shown varying degrees of effect, but they're really not ready for generalized use, and we're not entirely sure exactly how effective they are. The treatment for this virus up until this point has been sort of supportive care, meaning make sure that the person who is infected is hydrated, either by encouraging them to drink fluids or placing IVs and giving them fluids. By that means if they're not able to, and support for their breathing, whether that be supplemental oxygen all the way up to a mechanical respirator in the most severe cases. Things that you can do to protect yourself from the coronavirus. First and foremost, I would say please limit your travel to China unless it's absolutely necessary. They are in the midst of an ongoing outbreak, which is stressing their healthcare system, and the vast majority of cases are in mainland China. So limiting exposure is your best bet to avoiding getting sick. Second, good hand hygiene, using soap and water to clean your hands for at least 20 seconds, or an alcohol-based hand sanitizer, at least 60 to 75%. If those are not available, avoiding touching your eyes, nose, and mouth, avoiding close contact, like I said, between 1 to 2 meters from someone who is currently sick. Disinfecting and cleaning frequently touched surfaces is another great thing to do. The virus does not live for very long on touched surfaces, typically less than 1 to 2 hours. However, if someone coughs in their hand, touches a rail, and you touch that rail very shortly afterwards, it is possible to infect yourself with it. So keeping surfaces clean is an important way of protecting yourself. If you are sick, please stay home. Just please stay home. And refrain from touching livestock or wild animals. Household pets are not known to transmit viruses, but livestock have been known to make allow viruses to make that jump. And finally, if some medical transportation for anyone out of an area where there's ongoing cases or who may or may not be infected with COVID-19. The transport of people outside of a quarantine situation will not really be possible, both largely for legal reasons. Any medical transport that we are able to do, or anyone is able to, will require a biocontainment unit, something very similar to what was used in the Ebola cases in Africa several years ago, and will require the agreement of all national authorities, both from the area where the patient is leaving and to the country where the patient will be going to. Any form of commercial transportation really should not and could not be considered, as it would put too many other people at risk. Also, it's important to note that one of the negative impacts of the travel restrictions from this outbreak has been a limited ability to do medical transports for people who are not currently infected with the virus. Travel restrictions have been placed by multiple countries, and they are differing in their severity, but they have limited the ability to get people out from these countries who may not be infected with the virus but have other ongoing medical emergencies. Guidance specifically related to international travel. First and foremost, reconsider travel to mainland China. This is something that has been recommended both by the US CDC and the World Health Organization, as well as several other nations have suggested, limiting travel, especially non-essential travel, to China, since it is the location where the majority of these cases are currently going. Individuals planning on traveling should seek advice on the potential hazards for those destinations. Although COVID-19 is what is making the news right now, realize that the endemic problems of those areas, whether it's diarrhea or other illnesses, malaria, are still ongoing and pose a much larger risk than catching this virus for anywhere you are currently traveling. Many international airports are conducting screenings, which typically involve checking the temperature and your recent travel history. We are encouraging everyone to participate in those, there for the overall safety of everyone involved. And realize that travelers who are going to or coming from an endemic area may be subject to additional screening or quarantine, and it's something to be aware of. These travel restrictions vary from country to country, and it's important to know what they are at the time that you are going on your travel. I'm going to hand this over to Alan to discuss some of the other capabilities and offerings that we have to support people at this time.
Yeah, I think the most important thing to take away from our support is obviously information. Please call us, ask for help, etc. If somebody is worried about their situation. I will talk about EAP programs in a second and some of our other tools, but I just want to remind the group here that you have great contacts with UnitedHealthcare Global. You got the 2020 Medical Outlook that we've pushed out on LinkedIn. We've done a special report on coronavirus, and we're going to continue to do updates. And if need be, we're going to continue to do webinars. But most of all, we find that if people have information, actionable information, they feel much better about the situation. And certainly, we want to make things less stressful. We have a clinical team that does everything in their power to get as much information to you and alleviate concern. So with the next slide, you'll see that we have robust international employee assistance program capabilities. If people do have anxiety, we ask them to reach out to us. They can reach out to us in China, etc. I'll also mention to you that have folks under our plans globally. We support under the plan's diagnostic testing and supportive care will be covered under the health plan's benefits. This is something that obviously is treated as any other health issue that would be typically covered under a program. But I do think that in times of stress and worry, employee assistance programs are a great place to remind people that they have access, they have support. And if their family has issues, please bring that up. We're eager to help, eager to support. We also have a wide range of services that many of you are familiar with, and certainly, look forward to people reaching out to us. The medical intelligence team has done a wonderful job pushing information out to our teams, customers, clients, families. I believe that there's a couple different areas here that we're going to be really supporting people. Please remind people who are under our plans that myuhc.com, the Health for Me app, are areas that they can get information. But really, reaching out to us directly if somebody has a great concern, a medical issue, etc., we're here to help. So where can you find more information? And I'll turn this over to Amit on this, but I do want to mention one thing that I think is really interesting, because I know he's got his favorite spot. I've been looking at that Johns Hopkins Center for System Science and Engineering, and there's a map on there that shows you where most of these cases are localized, and it's something that even a layperson like myself can understand. If you get a chance, I think it's a really interesting overview of the situation. But I know, Amit, you have much more clinical needs than I do. I'll turn it over to you to discuss where information is important for people to get.
Yeah, so thanks, Alan. Like I said early on, the source of your information actually is a very important thing to consider, especially if you're going to be sharing that information. The top two that I would really use are the World Health Organization and the U.S. Centers for Disease Control. The CDC has a website which is very accessible to just about anyone. It speaks to practical concerns and implications, and is kept up to date with the latest information on what you should do, including some basic on travel and hygiene. The World Health Organization also does a great job of that from an international standpoint. The website Alan mentioned is actually also one of the ones I've been using very closely. It is a map that demonstrates the current number of cases which have been confirmed, and puts them in a graphical format that basically everyone can understand. You can do a deep dive into a lot of these areas, and it puts a lot of the scope, it puts a lot of the data into a scope and a context that makes it easy to understand and appreciate. So I think all of these are great resources to use.
So the good news is we have some questions from the group chat, which I'll ask Ahmed to answer. Also want to remind folks at this time, we still have time for more questions. So down in the lower right-hand corner, please continue to send questions along. We look forward to trying to help answer those. So the first question that came in through the chat function, is there a known reason that people in China are getting more sick and dying than those catching it outside of China?
You know, I'll be honest here. I strongly suspect that the reason that the people that the mortality is higher in China than anywhere else is the fact that the Chinese health system is being currently overwhelmed by the number of people who are coming to them looking for help. This is an epidemic there of an extraordinary proportion, which is stressing their health services. As I'm sure we've seen, China has built 2 hospitals for over 2,000 people in under 2 weeks, which I think speaks to the scope of their outbreak and how bad this is. The issue here, I believe, for them really is that they don't have the people and resources to really manage this. You know, in the U.S., there have been 2 to 3 cases in the city of Chicago, and you know that is well within the scope of what we can handle. But China has been hit with 63,000 cases, almost 64,000 cases in less than 6 weeks, which is extraordinary. And the pictures are coming out now of their medical staff who are exhausted doing everything they can to support their people. And I think that's what you're seeing in those numbers.
Great answer. Next question, and I'll take a quick little answer on it before I hand it to you. It says, why is the virus such an issue versus other cold and flu viruses? And before you answer it, I just want to mention there's a great article, I believe it's in the New York Times today, called How the Coronavirus Hits All the Hot Buttons for How We Misjudge Risk. And there was a comment in there that I thought was really germane, is that we don't often look at the 98% or so of people who are recovering from something like coronavirus because of mild cases. But maybe I answered it, but maybe you have an additional point there on why this is such an issue versus the typical cold and flu virus.
Yeah, and I think you pretty much hit a big part on the head. One is that this is new, and 2 is that unlike a lot of the other cough and colds, this has the potential to be life-threatening. It's not life-threatening very often, but that potential remains, which I think leads to all of the media attention. I honestly believe, as a practicing physician today, the flu is a bigger risk to the average person right now than this virus is. There's been 115 million cases of the flu this year. There have been, I think, something like 60,000 deaths in the United States alone from influenza. We've become a little bit sort of acclimated to influenza, but I believe it's probably more risky than this virus is right now, but it's getting a lot of attention in part because of what it's doing to the Chinese health system and also because of the novelty of this as a new virus.
Gotcha. I'll paraphrase the next question that came in. Is there any closeness to having a vaccination for coronavirus or some sort of protection like the flu shot?
So I think a year is probably the most optimistic. We're probably looking at closer to 18 months to 2 years before this virus is ready, or this vaccine is ready, and that really has a lot more to do with the process of developing vaccines, how long it takes, safe testing, and proving they're effective. Standard vaccine development takes at minimum roughly 2 years. As far as how close are we to making it generally available to everyone, that is something that that's speculating, I think, too far into the future, and it's going to depend on what happens with this virus over the next 6 to 8 months, whether it becomes something that's widespread throughout the world, much like the flu, or if this becomes sort of a flash in the pan that runs its course and then dies out like SARS and MERS. So only the future will tell which way that will go.
So a question, first of all, any trips for travelers? And I'm going to throw the question out we got earlier is, should I take my business trip to India at this time?
Yeah. This is a great question, and this is, I think, something that a lot of people are considering right now with all the travel restrictions and everything else in a rapidly changing environment. Should I reconsider my travel to other places that are not China? If it's China, I would say yes, reconsider. If it's anywhere else, right now there is no really good reason to reconsider your travel outside of that area. There have been a few cases in India and other places. Europe has a handful of cases, but what we're not seeing is widespread cases. We're not seeing that these are breaking out into the general environment. So your risk from going on a trip is really more related to everything else and less related to coronavirus. If you're going to go for a longer trip, it's worth making some extra preparations. That would include, keep extra any chronic medications you take, anything you need, keep extra on hand. Be abreast of the ongoing news and progression of this. If an outbreak occurs where you are, you may want to consider leaving earlier before it becomes widespread or before you end up at risk. And if there's some time before your travel, keep a close eye on the news just to see where this is and where it's spreading, because you may have to reconsider that trip as you get closer. But right now, as this virus appears to be relatively contained in areas outside of China, there's no good reason that you should reconsider your travel.
Kind of an adjunct to that question. Sounds like we've had a business travel here. I've been to 4 or 5 airports recently and on planes. Nothing to or from China. If I start feeling sick and I have a fever, now what? How do I know whether it's the flu or the virus?
This is, I think, a reasonable question for anyone who travels a fair bit is, what do I do when there's something like this out in the world and I don't know if I probably haven't been exposed or I'm starting to get sick. Initially, I would treat this as if it were just the cold, unless you are aware of an exposure or a potential exposure. So if you're contacted by the health authorities that say, hey, you were, anyone who was in this airport during these days or these hours, we need you to get tested or screened, then that's a reason to go get tested. But as I'll point out from earlier, this virus is contagious, but it's not ragingly contagious, which is to say that if you're in an airport, like a large airport hall, or even in your terminal, and one person has this virus, but they're not within 6 feet of you, your risk is relatively mild and minor. Putting that in terms for a flight, we're probably looking at 1 to 2 rows away. So if this person was not sitting within 2 rows of you, the chance of you catching this is still relatively low. Been to 4 or 5 airports, you're starting to feel sick, I think your first point of contact would be to get in touch with your primary care doctor or go to an urgent care and say, hey, I've been traveling a little bit and I'm feeling sick. Can you take a look at me and see how I'm feeling? Most likely it's the flu or another cough or cold rather than COVID.
Dr. Armendecker, we only have time for 2 more questions, and then we'll wrap up. Our company has prohibited travel to China. We are now getting questions whether we should be restricting travel to other countries such as Singapore after having someone stuck in Wuhan and not wanting to get stuck elsewhere. What are your thoughts?
There's two parts. There's the medical decision and there's the business decision. From the medical standpoint, I don't think that there's a great reason to restrict travel to Southeast Asia or other countries because the risk of getting sick is not significantly higher right now than going anywhere else. The other question is, well, the reaction a lot of countries have had is travel restrictions, which involve, in some cases, things like, if you've been to China within 2 weeks and you're a foreign national coming to the U.S., you may be placed in quarantine. That's a bigger issue that has more to do with the business implications than with the medical implications, and that's a decision every business is going to have to make on their own if that's a risk they would like to take.
So last question, and it's one that we hear typically. With the virus situation, if we have a traveler that needs medical evac, I'm assuming they'd be quarantined before transport to the home country. And I'm assuming your answer will be contingent upon what country they might be coming from. Your comments on that?
Yeah, so this is sort of the complexity of international transport in that there will likely be, it's going to vary from country to country, but typically the most receiving countries would require a quarantine depending on how strict they are, and it would probably be a quarantine on the landing side, but not on the place that they're leaving from. The bigger issue there is that if it's from China or potentially some countries in Southeast Asia, that might become even more difficult. If you're going to leave China, you need to at least have a negative COVID test regardless of what you're being transported for before transport will even be considered. And there's still other restrictions which might get in the way of making the transport occur at all. So this is a big part of the reason that we're recommending you really reconsider travel to China, because if something happens while you're there, the ability of us or any assistance company to help you leave that area is going to be very hampered by the travel restrictions that are currently being put into place. So you may not be able to get the help you need if you're there because of COVID, even if you don't have COVID.
So I'd really like to thank Dr. Arwen Decker today. Wonderful job. I feel more comforted, yet still wary. Just want to mention to the group here that we will post a copy of this presentation on the UnitedHealthcare Global LinkedIn company page, or you can reach out to folks that you work with in the UnitedHealthcare Global family. We will also put together a link of this WebEx that folks can listen in on and post that at a date in the future. We really appreciate your time today. We hope you learned a lot. We hope you stay healthy and happy and have a wonderful Valentine's Day. We wish you all the best. And we will stay in touch, and if things do change, we will have another WebEx, but we'll continue to provide information and counsel. Have a great weekend, everyone.
Thanks for using WebEx.